Welcome to Thriver Talks with Stephanie and Nalie. I'm Nalie.
And I'm Stephanie.
And today is episode 19, SCANXIETY and how to cope with results.
It's pretty ironic that in the last couple of weeks, both Nalie and I had PET scans. So we both had our scans and have been processing our results and deciding our next steps. So on today's episode, we're going to not only share our results, but also give you some tips on how to deal with your own SCANXIETY and PET scan results.
So without further ado, here's episode 19. How crazy is it that we both had scans on the same week?
I feel like it's always that way. Like we both have treatment. Like there was one time where we were both like on the same like day and time getting Faslodex injections. We'd be
Literally.
like FaceTiming from the hospital, like ready to get your foot-long needle up your butt. Like
yeah, I'm with you. I'm right there with you, girl. So crazy.
Yeah, it was pretty crazy that we both had our PET scan on the same week, and it was just like, you know, kind of the SCANXIETY that never goes away of waiting not only your results, but my results. And
I know, I think there was ones that like I really felt bad you saying this, but at the same time felt so much comfort where you were like, oh my gosh, like I feel like I get 2 scans now.
It's true.
I know, it's like the bittersweetness of finding you a Thriver sis, right?
I know. It's like, you know, you're all in. So it's like, you don't want to be that annoying person, but I'm literally sitting there like, okay, I know she had the doctor appointment like half hour ago. Hello. But yeah, it was kind
checking
of just
on
like
you. Heart emoji. Same though.
It's been just like a very intense couple of weeks, I should say, right?
Yeah, I think I wanted to start off this podcast by being completely honest and raw and real. But for me, especially, it's just been overwhelming. I announced it on social media and on my YouTube channel where I didn't get the results that I wanted, but I have to say they're not like the worst results either. But it was hard on me psychologically because last scan, it was the first time that I had regression on Verzenio. So when you get a good scan, of course, you're expecting for the next after 3 months to be even better, right? I guess if you would think that healing is linear, which now we know it's not. There's a lot of ups and downs, and unfortunately my scan in February showed a little bit of a down because I went from regression to again progression. But the reason why I said that it's not that bad is because now we're basically just back to where we started,
back to the starting point.
Exactly. And thankfully everything else is stable, but psychologically I think it really took a toll on me, and I just wanted to disconnect. Truthfully, as you know, we've been writing the Thrivers Guide, but we haven't even touched our chapters in the last 2 weeks because, yeah, I just had to process it all.
Yeah, and I mean, rightfully so. You know, it's like like always what we preach is like you can't serve from an empty cup. So it's like, again, it wasn't bad news, but it wasn't the news you were expecting.
Exactly.
So you just needed some time, take the time to get back up on your feet. And that's part of being a thriver. It's not always, oh, I'm a thriver because I'm hiking this mountaintop. Like, I think that might be a misconception. I think thriving is honoring your body at all times, even if it's sleeping. Exactly. You're thriving because you're listening to your body.
Exactly. You're conscious and you're aware of what's going on in your mind and your body and your spirit. That's what thriving means to us. And yeah, I had to disconnect this 2 weeks, and I have to admit, wasn't the news I wanted. So it really took a toll on me. And I think that we're using this episode not just to share our story and how we feel, but also to give you tips because I finally feel, I was just telling Steph, like today is the first day where I finally feel like I'm, you know, back to being motivated, and here we are recording this podcast. And
just like sidebar, I had to like beg her to sleep.
I was like, I'm so tired. Why do I have to sleep? I don't like sleeping.
I know. It's like your body's trying to heal. Yeah. Please sleep. So yeah, good.
So what about you, Steph? Like, I guess we can start off by giving people a little bit of an update in terms of like, we both are diagnosed with stage 4 metastatic breast cancer. It's not the same as like, this is the whole point, right? We're trying to spread awareness on like MBC and the differences between MBC and early stage diagnosis. So you who's been thriving for 9 years now, what are your scans like, and what's going on within you right now?
Well, before I get to currently, I just like for anyone watching or listening,
I just spilt my tea all over me. Wow. Oh boy. Okay, sorry. Go.
As long as you're not burning.
I'm good.
So it's been a roller coaster, you know. I'm in a good place for the last few years now, but I had my dark night of the soul where I was just like getting bad news right and left and got really, really sick. So just to give anyone listening or watching some encouragement that I haven't been on this like straight path for a long time. I had to go through lots of bad scans, progression, regression, the whole mind debacle. I don't want to curse, but it's like just like a whole like mind fuck. Sorry, Kay. Bye. I won't say it again.
I mean, Thriver Talks. You're allowed to say whatever you want, girl.
But yeah, it's just like lots of ups and downs and twists and turns. But just to get up to present, so I think on one of our previous episodes, I had told everyone that like for the past, I would say 3.5 years, I've been treated for these 2 spots on the right pleura of my lung, which is the sac that outlines your lung. Mm-hmm. And these spots are kind of like unchanged, but sometimes on a scan, they'll be like a little bit brighter, a little bit dimmer, a little bit brighter. And my intuition has always told me that these spots are scar tissue and not cancer, because when I was really sick and I was getting bad news right and left, I had 2 collapsed lungs from cancer. Yeah. And in order to breathe, they were giving me thoracentesis and putting really long needles into my lung to drain fluid. And I was getting these done pretty regularly. So it's only made sense to me. And it was especially in my right lung. Like there was no breathing capacity whatsoever, and I had minimal in my left. So it was the right lung that was problematic. So my last scan, I decided that I was finally going to kind of take matters into my own hands. Through Dr. Wong, our Chinese medicine doctor, he referred me to a specialist in Manhattan, and his name is Dr. Bard. Yep. And he has a special machine that will pretty much zoom in on these spots or whatever spots you may have and determine if they have blood vessels or not. So essentially, cancer is just like a healthy cell in that it needs blood supply to grow and thrive. And so I went to Dr. Bard, super nervous but anxious to get results. And prior to that, I must say that my oncologist was telling me every time I'd kind of stress to her, I think it's scar tissue, she said, well, it'd be really hard to find out, but the only way to determine is through biopsy. And I really didn't want to cut my lung, especially for something that's not life-threatening or detrimental to my health if there's just these stubborn little spots that have kind of just been hanging out there for a few years. Mm-hmm. So went to Dr. Bard. Long story short, he did this exam from pretty much neck down, and it was almost like he took a flashlight looking in like every little crevice of my body, lymph nodes. Didn't find anything. And then when we got to the lung, he said, yes, I see something. It's non-vascular. However, there's no blood supply, so it's not cancer. So I took these results to my oncologist, and I don't think she really has too much faith in this test because it's something that they don't offer at my hospital. Although it is the standard of care, this machine that this Dr. Bard has throughout the whole world. Do
you know what the machine is called?
I don't. I mean, I do. I have it like in my pictures because I took a picture of the machine. But if you Google Dr. Bard, it's Dr. Bard, BARD NYC. You can look up his website. Mm-hmm. But essentially, my current scan, that brings us to today. So right after Nalie had her scan, I had mine.
Crazy.
So crazy. And the scan came back. Everything is the same, except they might see like a little bit more increase in uptake in those same 2 spots. Mm-hmm. And as soon as I heard that, I just had a sigh of relief because I know it's not scar tissue. Exactly. I mean, I know it's not cancer. It's scar tissue.
It's scar tissue.
Yes. But my oncologist, because she's just like, well, let's just see if it's cancer. and B, if it is, what's its, genetic sequencing. But so I'm kind of in a place right now where I'm torn because I know that it's scar tissue, even though,
You just need
she's doing.
the proof.
So I went back to Dr. Bard this week. Talk about being your own advocate. It's so tiring, but it's just
exhausting.
so exhausting. So I called him up immediately. Said, he told me not to come back for 6 months, but here I am 6 weeks later. And I did the whole entire test again. And I was kind of nervous, even though I'm like, how could these spots grow like blood vessels in 2 months, But essentially the consensus was that in comparison to his last findings, which were in December, to his findings this week, it's unchanged. It doesn't appear hot because cancer appears hot, and no blood vessels, non-vascular. So it's not cancer.
Thank you, God. Thank you.
Best news, but all to say that, and I'm never discrediting oncologists or the job that they do, but I think in order to thrive, you have to always be your own advocate, especially with metastatic breast cancer.
Absolutely.
And, so now I'm just back to the drawing board of deciding like what to do in terms of, my next steps. But overall, big picture, I'm so blessed with the news that I received, but I'm tired from.
Of course, it's a long journey. Yeah. So technically, you're still NED, no evidence of disease, correct?
Yeah.
By the way, I did the Googling for everyone. It's a computerized 3D Doppler histogram analysis, which essentially, using state-of-the-art equipment, uses unique forms of sonography to evaluate blood flow related to tumor activity and to identify areas of suspicion. So it's less invasive than a biopsy, but it, just like a biopsy, determines whether or not the cells are cancerous or not. So I think your story is such an important one for anyone living with, like, I guess, a metastatic breast cancer, period. And
or even just that, even for like earlier stages, like if you just feel something's off, or if you just want to know, like, because sometimes, any test is there's room for error, right? Or false positives. So if you just want confirmation or another layer, then I always suggest like going and getting that second test. Even Dr. Bard said that there's another test that I can do. It's a special MRI that, he's like, if you want another layer of confirmation, he'll refer me, but I'm just not ready. I'm like, okay, I'm good where I am right now, but it's good to know that there is another test that I could possibly do if need be down the road.
I like that you said that if you're in a space where you're confused or you're unsure and you just want that extra confirmation, is this really cancer? Do I really have cancer? This is the less invasive way to confirm it, and it's quite accurate. So I think this story is a great example.
And I confirmed, even though my personal oncologist isn't familiar with the technology, I did consult with a couple doctors whom I trust, and they both said that A, they knew who Dr. Bard was, and B, that the test was accurate.
There you go.
That was all I needed to hear personally. So,
Steph, your story of becoming NED after 9 years is one that really inspires me. And as I was tripping this past couple of weeks, Steph always came in and was there to remind me that, like, in her 9 years, it wasn't always regression, that you also had bit of progression here, new spots there, then they were gone, and then they came back, and all of that. So I want to spread the hope that you give me daily with others listening. So a bit of a history of your scan results in the last 9 years. What did it look like in terms, if you were to like draw a little graph? Yeah, like briefly, how would you say?
Lots of ups and downs. Like for the first few years, it was stable, but stable still meant a little progression and regression, but nothing like too alarming. And again, when you're doing, see, I think in Canada, you guys do CT scans. And in the States, we do PET.
So what's the main difference now? And then we'll get back to your graph.
It's like the radioactive FDG uptake. So basically, cancer is hot. The glucose, the radioactive glucose is going to go directly to where the cancer is. And based on the intensity of the brightness of the spot that lights up, they can determine how active it is. So they use a scale, the FDG uptake, and that they measure the SUV. And if it's up, they'll say, oh, this spot's a little more active. Or if it's down, it's a little less active. But it's always interesting to me because if I'm not doing PET scans and I just did a CT like you, then my scan would be like these little spots wouldn't even be a question because they're just looking at the spots, not the uptake and increasing so slightly. So anyhow, again, back to old scan results, it would just be like a roller coaster, every three. And still to this day, after 9 years, and I think this is so relatable to anyone with any stage of cancer, even sometimes too, I think that like people who are in remission and they still have that 1 yearly scan, like that has to be just as crazy as every 3 months waiting for results,
A 1,000,000,000%.
Yeah, it's like you're in the clear and then you like get this 1 yearly scan. It's like all year what has gone on in my body. Am I still healthy? And so anyhow, yeah, the scanxiety was just, it's never ending. It's still there even 9 years later. But back to your original question.
Yes. So what was your pattern?
I would say at first, like I was saying, little aggression, little progression, but stable.
Yeah.
And then when I got really sick, and if you guys listen to episode 1, you'll learn about my misdiagnosis. But when they initially took out my first tumor, I had a lumpectomy. But then in that same spot, about 4 years into my journey, another mass started growing back like really quickly and really aggressively. And my numbers were always an issue to me, Nalie. And I tell you this too, because it's like, so like, it's hard to get past the numbers.
I know.
But I would fixate on these numbers and they controlled me. And finally my dad was like, stop looking at the damn numbers, like stop. It's like ruining your quality of life, because I would literally obsess over the numbers until my next appointment. And so when I got the recurrence and the breast, like my numbers were shooting up. This wasn't working. That wasn't working. And then they went down, back up. It's just been like a graph of like up and down.
I honestly just wanted you to even express that, because I feel like that gives me a sigh of relief, just seeing how well you're doing now, because I'm currently going through a down. And so to even just hear you say that is already like a, okay, so I hope that this does that for you listening.
Well, that's like when we talk on the phone, I understand exactly how you're feeling, because I probably obsess even more. Like sometimes you're so chill about it, and I'm very like compulsive, so the numbers would drive me crazy.
Yeah.
So today, like, I've been in this place where my numbers have been good for a few years. And but what I started to do when I got to a good place was instead of like, I know how the online portals are really great because you can have access to all of your medical records in the palm of your hand, but I disconnected from the portals because I don't want the email to come in and be like, oh, here's your CA 2729 and your CEA like every month. So I disconnected from the portals. And when I see my oncologist now, she knows I don't want to know the numbers. Just tell me if they're good, normal, cool. And that's all I need to know. And that for me has given me so much peace now, because I'm not, oh my God, it went up 5 points. And so just a little tip, like when you are in that good place, to kind of just let your oncologist use the numbers. My oncologist that I had prior to this one, he was so amazing. But he would always say, the numbers aren't for you, they're for me. Like, stop the numbers. They're for me to know, like, if what I'm doing is working, and they're for me to do my job, not for you to look at. So I'd be like, okay, yeah.
That's really powerful.
Yeah. So that was really helpful. It was almost like his permission. He gave me permission to stop looking. And my dad was always like, stop looking.
Yeah.
So that provided me like so much peace.
Right.
But yeah, like it was so much up and down, and just, highs and lows, celebrations, letdowns, constant. It was just constant, like being dragged through the mud kind of, because.
Absolutely.
And then you have these 3-month gaps of windows, like between scans, where you're just like, as soon as you get through a scan, and I know anyone can relate to this, and we talk about this, is that you're like, okay, at least I know now. And now I have 3 months to live my life until the next scan.
Yep.
Right.
Yep. And they come so fast, like it's crazy.
I know.
And that's like the frustrating pattern for me, just very briefly, for those listening who are new to my story. It's that after the recurrence, when I did chemotherapy, thankfully the lung nodules had shrunk significantly. And that's when I was stable for like 2 years or a year and a half or so. And when I moved on to hormonal therapy, but then after like a year being off of chemotherapy, those nodules kept showing a bit of progression, but so like minimal, like millimeters. We're talking millimeters. And I too was going crazy. Practically wanted to take out the ruler and like measure it, because I'm a visual person. I like to see my scans because I use these images to really visualize them going away, and I feel like it helps to know where it is, so I could really focus my energy on healing the area. And so in the last, well, since 2018, I would say that I've been having minimal progression, and it's been consistent minimal progression every 3 months until last October 2019, when I got the first tiny itty bitty bit of regression, which is why, fast forward to today, I guess we're in March now, last month's scan, when I got again a little bit of progression, this was, I guess, my first, like, in a graph, like up and then down and then up again, I'm sure. But it's been pretty like stable for me for the last 3 years, where it was like stable. Oh, okay. Minimal progression. Oh, yay, regression. And then, okay, we're back to like before. So this is my first experience
but
of
I don't
the
think
up
it went
and down.
like, I don't think it went back to before. I think you're just like,
yeah, like, ooh.
Your back. Yeah, it was just like a hump in your back, like here.
Exactly.
So
but when you know how we all receive negative news, it's like, to us, even a hump is like a fucking giant summit of Mount Everest. Do you know what I mean? So that's what I was dealing with this month.
But I also like I thought that I had this epiphany, which I texted you the other day, was so next week or this coming weekend, we're both gonna be at the Miami Breast Cancer Conference. Nalie's giving the keynote for the 1,000 oncologists, and I'll be the keynote for patients. And what I was saying was, this time last year, when we were at Miami Breast Cancer Conference, we were in the same boat. Like, I had these two little spots, and you were exactly where you are today.
Yes.
So I think it's like important, like, that's a win, because you're fine this whole past year and you're going to be fine this whole year. So it's just sometimes just like,
that's a great way of seeing it, because like you said that, and then the first thought that came to my mind was, oh my gosh, here we are repeating the same damn pattern, or we're going in circles. But your perspective is the shift we all need to do. It's okay, yes, have that frustration, but then shift into gratitude. And you're absolutely right. We should be absolutely grateful that we're even here to return to Miami, and to, have all these options and to learn about all these options that are opening up, and what's in the pipeline. But
and be with like the most renowned oncologists in the States. So I think that's like
huge.
What better timing, right?
Exactly. That's how we have to see it. So speaking of dealing with scan results, let's talk about just the scan anxiety. Like, I feel like people are like, does this ever go away? What do I do? So let's go in like order. When you said it, we get scans every 3 months. Unfortunately, I have one in 2 months because of the results. Usually people living with MBC, it's every 3 months. Others, it's every 6 months. And then if you have an early stage and then you're still monitoring, it's once a year, right? But it's different for everyone. But I think that if anything, this is what we all have in common. For any stage, for any diagnosis, scans are nerve-wracking as ever.
Oh my God, yes.
And like, how many scans have you had, Steph? Like, you count them. I don't even know how many I have.
Well, I didn't count, but my mom, she was like, do you know that this is going to be your 30th PET scan?
How does your mom know that? So she counts them.
She must have been like, just,
wow.
She hates that I do all these scans, and that's a whole other, like, she's very anti a lot of the stuff. But anyway, 30 PET scans, and so I just had my 30th, which is insane. Yeah, and I mean, it gets a little easier.
It
I guess
does.
maybe too, I have permission to say that too because I'm in a good place right now. But the anxiety never fully goes away. Like it's always there.
When do you feel it most? You do feel the anxiety most?
After the scan.
It's after.
Yeah, because the scan is, that's the easy part, going and getting the procedure done, but it's that like window of waiting, and then like all these things run through your head, like the worst case scenario. But then I just have to bring myself back. But I have to say that this last scan, like when I used to be like even go into the machine, I used to have to take a lorazepam because I would be so nervous.
Are you claustrophobic?
No, I would just start
just be
panicking.
Nervous about it. Yeah.
But this is, like 9 years ago. And then I would take half a lorazepam and then just take a little nibble off of it. And now I don't take it.
Right.
But I made a mental note that this time in the scan, I was so at peace. I was just like, I never felt so much peace in that machine. And I was like, wow, I've come a long way, because I used to freak out,
Right.
But I just think with time and learning how to cope with results, I think being your own advocate and always having a plan, like, knowing that if it goes this way, this is my plan. If it goes the other way,
these are my options.
So I always like to have that. And, like, I'm like, I don't take no for an answer. I will go find my answer. So I think that having a plan and being informed, which I think that's what I'm going to speak at the
Miami Breast for patients, right?
Being your own advocate and knowing, like, ahead of time, like, what are my treatment options? What treatments are in the pipeline? And just all these alternative therapies that you can try, that maybe you haven't tried or that you want to try, that have piqued your interest at some point. So I think just having your own personal plan, that always brings me a little comfort.
Yep. Yeah.
And just trusting, like, I've just gotten to this place and I just trust my journey now. I think I've been through so much that I just have faith in my outcome. What my journey is what it's supposed to be. I truly believe I'm supposed to be here for a while to, with you, to make a difference for all of us listening and watching in this community, to make, especially in our case, a lot of noise around NBC, because 9 years ago, no one was really even talking about it when I first got diagnosed, let alone young women. And I feel like we're starting to make noise and be like, hey, doctors, like, I'm still living in here. And
that's my speech. That's what I'm talking about for my keynote. I'm going to be like, hey, stage 4 here, still here. So pay attention.
And a lot of women are. So it's like the funding needs to go to us. And so there, without stage 4, there's no, I always say, like 3, 2, 1 or Previver. It's like, let's put the money where it matters and find a freaking cure and make this a chronic illness. And I think we are getting closer to that. But so I find comfort in that too. But I know that we have to do, and I believe it's our purpose to have a part in seeing this come to fruition.
Amen. Yeah, when I guess I've pretty much mastered getting this scan, and I won't lie, I have a calendar and my calendar is quite busy, so it does rattle me when I see the date, and then I see CT scan. So I feel like sometimes even like psychologically, unconsciously, it affects me when I see that, because as you mentioned, it's true. I feel like we live in like 3-month increments. So here I am working on such great projects. For example, excited about Miami, working on my speech, and I'm focused on our mission, on our purpose, on doing the things that I love. And then when I see the calendar update, I'm like, it's just like a big downer.
It derails.
Yeah, it derails. Exactly. Yeah. So that's something I'm working on. But then when I go and get the scan, I think both you and I have our little rituals around it where we try to stay grounded and centered so that we can have those thoughts that you just mentioned a couple of seconds ago, and in order to focus on that, I think we both pray, we meditate. When I think we both go into the bathroom before. I do it when I change into my hospital robe. I always say a little prayer and I proclaim my healing and I say my affirmations. So once I get into the scan, I never had that type of anxiety of being like, oh my gosh, it's happening. I just take the time to relax and meditate, and I always talk to the technician, crack a few jokes here and there, because as you know, there's always that weird sensation of pissing in your pants. Do you get that? Do you ever get that? What?
No, but I know what you mean, because every hospital I've been to is different. But as I'm going into the machine at my old hospital, they would put the contrast in and it would like tingle.
Yeah. Okay. Anyone listening to this who feels like they're pissing in their pants, please send us a DM or something, because I swear to God, it's the same feeling every time. And that's how the technician will always be like, be aware you're not pissing in your pants. It's normal as the contrast goes in through your IV.
Warm, like tingling.
You're
feeling.
Like, oh my God, what's happening? Yes. Okay, so I'm used to that, and I always crack jokes with the technician. And once it's over, it's fine. But then you're right. That's when the scanxiety kicks in. Now we're talking about the waiting
when
period.
I come out the machine, I'm looking at the radiologist.
Yeah, me too. Through the window, I'm like,
I'm so convinced. I've told my mom so many times. I saw the look on his face. I think he saw something. And she's like, what are you talking about, Stephanie? I'm like, I know. I could just feel it when they walked in the room. I could feel that they felt bad for me and sorry for me. And then when I walked out and I saw him looking at my pictures, he got all nervous.
Don't you feel like you could just
this whole drama in my head?
Oh, yeah. I feel like I just want to barge into the room and be like, excuse me, I have a question. But then really like peek at the monitors and be like,
and they're probably not even looking at
your image.
Exactly. And it's like, even when you see pictures of scans that are NED, they're still lit up. So it's like, because they're supposed to be lit up in certain areas. It's like, we don't know what the hell we're looking at,
exactly.
So
like, try if you can, learn from our mistakes.
Back, put your clothes on and get out of there.
Just get out of there. You don't need to be there. That's our number one tip for this episode. Yes. Don't do that. Just don't. Go home. No. But what I do as a little ritual is V and I, usually I'm accompanied by my amazing boyfriend, who then takes me out on a date after. We always go out to eat or go watch a movie or do something to change our minds, like immediately after. Like I even forget technically that I did the scan. But the hardest part is when you're back home and you go to bed and you wake up in the morning. Time. What do you do between? And so how long do you have to wait for scan results?
It just depends. It's usually like 3-4 days.
Yeah.
I usually do them like on a Friday, Saturday, and get the results like Monday, Tuesday.
Yeah.
So it's a few days, but like you were just saying, like I just keep myself busy, just do what I would normally do. I'm not going to sit at home and think about it and cancel plans, because that's not going to change the outcome or make anything better. It's anything, it's going to make it worse. So just keep your plans, stay occupied. And then if you're getting the results on the phone, just make sure, like, this is a tip also, is like, just if you know at a certain time you're supposed to call your oncologist or they're calling you, be in a quiet, safe space at home. You're not out driving or grocery shopping or whatever. Just make sure you're in appropriate environment. And or if you're going in to get your results, then just take someone with you if you can. Or
my tip would be to be so clear on when you're going to receive the results.
Yes.
So like what I will do with my oncologist is that I'll book my appointment to receive the results. And I'll know that, say, my next scan is on April 16th, that my appointment is on April 20th. So between the 16th to the 20th, I'm going to do everything in my power not to think about the results, because as you mentioned, your thoughts won't change the outcome at that point. The scan happened 4 days ago. The results will be of those what they took 4 days ago.
Exactly.
And so that's where I try to keep myself occupied doing the things that I love. But this is where I try to lean on like others. I feel like the whole meditating, going inwards is before the scan, but now this is when I call up my friends. I try to organize some kind of activity. Like my friends crack me up, so do anything that makes you laugh. Go see a comedy show. Do things that like actually make you have fun and laugh and put you in a good space in between that time you're receiving the results. And then know that, okay, if you're receiving the results on this day, how are you receiving them? Is it through the phone? Is it by, I don't know, email? Is it through an appointment? Just make sure that that's so clear so that there's no, so you avoid the, oh my God, is he calling me? Oh my gosh, is
that
there?
was me.
Yeah, that was me too. Cause then I would get private, unknown like caller IDs, and then I'm going to think it's the hospital. But then if you see that now, usually they're from UPS because Chinese herbs, you know. So when I get my packages of Chinese herbs, I always think it's the damn hospital. But when you make it so clear on how you're going to receive the results, you avoid those panic attacks of when your phone rings and you may think it's your doctor. So make that really clear with your doctor as well. Be like, you know what? Whatever it is, just tell me on our appointment on the 20th, you know?
Yeah.
Mm-hmm.
So I think if we were to sum up like what we just said, like just to give like a, so prior to your scan, like leading up to your scan, formulate a plan, right? Like, so whatever the outcome may be, knowing your treatment options and just having a plan, like no matter which way the scan goes.
Plan A, plan B.
Plan A, plan B. And then, like you said, like a couple days leading up to the scan, you're forever praying and meditating, but going within, I should say, like taking a lot of time to go within prior to the scan. After the scan, like keeping yourself occupied, trying to have as little idle time as possible. That's that saying, like idle time is the devil's playground. Like your mind will play every trick on you. So try and, keep yourself occupied, lean on your loved ones, and then have a concise time and appointment and know when you're getting results. So there's no anxiety around that added onto your stress you're already having. And then whatever the outcome is, you refer to your plan A or B and hold on to your faith that healing is not linear. Our plan is never God's plan, and it's sometimes we have this idea and picture of what our outcome is going to be in our mind. And I've learned that the hard way. I thought after 5 years, okay, cool. But now I had to go through more stuff so that I could fully, I believe, understand and relate to pretty much anyone's journey
and serve.
So really just surrendering and having faith. Like, I think too, even like getting not the news that you're anticipating, but still moving forward is an act of faith. It's like you're proclaiming your faith that, okay, I didn't get, this doesn't physically look like how I wanted it to look, but I know that I can heal. Anything is possible. This is my outcome. And you just keep moving. And to me, that's what thriving is.
Amen. And that brings us to how to cope with results, right? I think you just tackled it, just having faith, but sometimes that's a little easier said than done.
Oh, absolutely.
So let's say you get negative results, which you have in the past and which I got right now. And right off the bat, I think one thing I want to say and actually say to myself too is just to honor your body and your feelings. And, don't, and a lot of people think that I do this. I actually got a couple of DMs after I posted my vlog about my results where people were saying that, like, I don't have to always be positive and always, try to find the good in everything, which, that's my motto, find beauty in the battle and so on and so forth. But in order to do that, you really need to honor your feelings. And this is what I've been doing in the past 2 weeks. And it's been so exhausting. That's what I wanted to say. My first tip is take the time and take as long as you need. And if you need to cry, cry. Just let it out.
Let it out. You have to feel it to heal it.
Exactly.
So if you need to cry, cry. If you need to scream, scream. Get it out. But just you don't stay in that space.
Exactly.
You can't occupy that space,
don't feed your energy into that space.
Allow yourself, and I think too, just being vulnerable, it's like you're so public with everything. sometimes too, you feel like, okay, I have to get back up and serve. And what I've been trying to say is like, like you can't serve from an empty glass. Like, no, take these 2 weeks to replenish your body, rest, process all of the information you just got, do all of your therapies that are going to make you feel better. And when you start to feel better, today you're feeling better, then you can, step back out into the social realm. But it's okay to take time off. And I've been telling you this,
Yeah, it was a hard thing for me to do.
Yeah. Just to honor your body, like listen to your body, and knowing that sleep is, we both struggle with this because I think we associate being sleep with being weak and something's wrong
unproductive
with that.
and not successful in that sense, and not serving and living our purpose or mission. But it's quite the opposite. You said it best. It's like, in order for us to serve, we need to have the energy. So back to the quote that I just posted in terms of me, because I went ham on like my therapies. I got a massage, I did acupuncture, and it's like Chris Carr always says, what if your purpose is to take impeccable care of yourself so that you can have the joy and energy to serve others?
Amen. So I think allowing all of your emotions out, that's healing, and doing whatever you have to do to get back up and getting back on your road to your plan.
And the way you do that is now, I think, after you let that out, I think a lot of people are like, how do you not stay there, right? And getting back into your plan and you're back on the road. I think my biggest tip is to shift into gratitude. So you let that out, you take the time, you accept the results, but then you shift into gratitude. And that's something I was able to do, is like, Steph, you're absolutely right. It's like the fact that we're even able to go back to Miami, the fact that my overall scan results were stable, the fact that, look at me here speaking to you, and I'm not necessarily symptomatic to a point where my results have caused, more symptoms, so I can't breathe or I can't walk or I have no energy, which is something you actually faced.
Yeah, I
right?
mean, that's what I was sharing with you, is, when you were struggling with the rest and allowing yourself to, I was bedridden for months, and all I could do was rest, like when I had 2 collapsed lungs, when you can't breathe, like your lifeline is cut off. Like I had to be carried to the bathroom. So I know what it's like to have to rest and sit there and really sit with your symptoms and the fear. But I have to say, and I know this is like really hard for me to teach, but it's like in those moments when you really have to go deep. And that's like, I mean, even as sick as I was still affirming my healing. Like, thank you for my healing, like all day, every day, and just believing that I could pull through this. And honestly, in hindsight, when I look back, like, I'm like, how the hell did I do that? Because I mean, I was like on death's doorstep,
Exactly.
And all my friends that came to see me, I could see the fear in their eyes, like I really think each time they thought like, okay, is this our last goodbye? But it's like, so I was very, very sick, but it was during those times that I really, went really deep within and really like anchored in my faith. And really like did that, a lot of reading, a lot of books, a lot of reading, and that inspired me. And I just kept my faith watered, like I kept watering my faith no matter what physically the outside looked like. I kept believing within like what could be. And I really think, because there's really no explanation other than I don't know. I think it was a combination of all the things I was doing, but I always say like my faith, I think is what got me through my hardest time.
Absolutely. So knowing that, I shift into gratitude because, you've been through far worse, and this beautiful community, we connect with women who reach out to us every second of every day to tell us their circumstances. And I already know that there's a lot of other women who, get results that are far scarier than mine. And I'm not trying to take away from my feelings. My feelings are valid.
Totally valid.
But that's why I think it's important to feel it first. But then I start thinking about how lucky and blessed I actually am. And like you said, you water your faith. I start also watering what is thriving. And I'm like, oh, okay, well, today is a better day. And yes, it's in the lungs, but it's nowhere else. And I get to wake up every morning. I get to take deep breaths. I can still do my yoga. I can still do my everyday activities. Yes, I'm a little bit more tired than usual. Yes, I don't feel like 100% myself.
I'm more tired than usual.
I think we all are.
I think what's like, this is like deep, but like, if you really think about it, it's like winter, right? Especially like living on the East Coast. It's like everything's dead right now. Like I'm looking at my window.
Yeah.
It's just like sticks, right?
Yeah.
But in like 5 or 6 weeks, these trees are going to be friggin' blooming and blossoming. But they rested all winter. They rested all winter, and slowly, ever so slowly, they start to come back to life. And I think that's with healing too. It's like we, of course, like I'm guilty of this too. We want results fast.
Yeah.
It's like you have to let your body do what it needs to do to heal. And a lot of that is resting, and nature has this innate intelligence. Like the trees sleep all winter long. I'm not saying we're trees, but like we are part of this intricate system, and animals hibernate all winter. So it's like heal, like let your body heal.
Yeah.
And it's healing is not always what we want it. It's not always pretty, and it's not always what we want it to look like, but just trust the process.
Exactly. So once you shift into gratitude, definitely just keep it moving, trust the process, and start resume life, right? And go do your plan B. If you had the plan B, get back on the horse and follow the plan B. Go visit your healers, go get those second opinions if necessary, and focus on what's thriving. Focus on what's working in your life, and
Exactly.
and where what's the saying? Energy goes, or
energy flows where energy goes.
Yeah. Anyways, you know what I mean. Just now you have a choice on what you're going to water, what are you going to focus on. I think also, having done so many scans too, Steph, like, don't you find in the end it's like, how much really do these, how do I say this? Like, how much do these results really affect your life? Do you know what I mean?
I mean, I think using your example, what I'm trying to tell you is like, you have absolutely every single right to feel the way that you're feeling. And I always tell you, as your Thriver sis, I'm going to try and offer you a different perspective and keep you going. But it's like, you got this news and it like your world fell apart, as for that moment in time, as anyone's would.
Yeah.
And I'm probably more dramatic than you. So I think you handle the news like a champ. But to bring it back to like, hey, you're still in the same place that you were last year.
Yeah.
And these little changes that are like so minute sometimes. Yes, if it's something major, then, but these little ups and downs,
exactly.
Like, I don't know, like, you know what I'll say is, remember my old oncologist told me, slow and steady wins the race, right?
Yep.
And he would say, he's like, I would rather you have stable little progression, little regression. That's all stable with MBC, than have these big highs and lows.
Exactly.
It's like you're in remission and then you're not in remission. And then like he just said, slow and steady wins the race, so these are all wins. And I think your scan is a win.
Yeah.
And I think that like, just looking at that perspective, going through the emotions, feeling all the feelings that you've been feeling, but then we're going to Miami Breast Cancer this weekend. We're going to learn all of the new latest, greatest, and we're going to share with our community through social, and just hanging on to the hope of what the future looks like.
I just feel like and I feel like anyone listening, I hope you could relate to this too, but like I feel like we're both done with the whole rat wheel of this vicious circle where it's like, okay, yes, we're living in 3-month intervals, but really, how much does this scan affect our lives, our day-to-day lives? Like,
all the scans where I thought my life was coming to an end.
Look at you
I'm
now.
still here.
Exactly.
You know?
So that's why
So
I feel like unless something really physically is like preventing me from being myself and moving forward and doing what I do every day, I feel like it's our duty to really do the work so that our mental doesn't prevent us from living our lives every day as we could, despite the results or not. You know what I mean? What if we didn't do these scans and we just kept moving forward?
No, I think about
what would change? You know, what would change?
Just not putting so much emphasis on them. Don't put so much
power.
Faith,
exactly. Don't give it so much power. Like, I feel like that's something, and I'm saying this because it's something I want to work on. I'm so fed up of giving these damn scans and the results so much power, because what I've learned having this beautiful community is that whether you are stable, whether you are any ED, whether you are in remission, whether you don't even have cancer, things can change like this. There's no damn pattern of like, you know, I don't know, you're 100% always going to be perfectly fine. Only you can know that, right? But no one can confirm that for you in these circumstances for anybody, history of cancer or not. So when I think of that, I'm just like, you know what? Like, anything can happen.
To kind of just like add to that, and this is just me after my personal journey, but before I go to scans, I just tell myself, no matter what it is, you're okay.
Yeah, exactly.
Because I know that even if they see something, I know what it feels like to be really sick, and I know that I'm okay in this moment, and I just have to always remind myself. I wasn't going to share that because it's like something so deep, but I always tell myself, whatever it is, you're okay.
Thank you for sharing that, because it's true. And I have, when I'm able to go deep, that's what my inner voice tells me. And I think all of your inner voices would say the same too, if you really allowed it, if you actually really took the time to listen. Because even in the worst case scenario, I just feel like no matter what, it's okay. It will always be okay.
All is well.
All is well. Always.
Yes, and always, and always, and always.
Yes.
So, all right.
So I think that pretty much covers it. I hope so. Right?
It's kind of just all over, but this is Thriver Talks, and we're just sharing our experiences and just giving you some like real, raw, authentic experience and advice and
how we deal with this and then the craziness. But I think this advice also goes for anything else that's been, you know, giving you anxiety or any fears you may have. I feel like the SCANXIETY is always the best example and recipe to a mix of just fear and anxiety combined. SCANXIETY is the best metaphor. Storm. Oh my God.
On a brighter note, we will be in Miami in a couple days after this airs, and we have some great content. So we're going to interview some professionals and bring some great content to you from Miami. So I'm looking forward to that. So, yeah. All right. So thank you for tuning in. And if you know anybody who is suffering from SCANXIETY, please share this episode with them. We're available on all major podcast platforms. And please subscribe to our newsletter. It's www.thethriversguide.com. And like we said, share this with someone in need and rate and review us too.
Yes, please. And always remember, where there's a thriver's will, there's a thriver's way. We'll talk to you in the next one.
In Miami.
Oh, snap. Bye.